the volume?
So, am I audible?
Yes, please.
Hi. So, I think I'm ready. Patient has been waiting, so I'll finish with the surgery first, and we can always discuss. Khyat has really encouraged many people like me. So I'd like to thank Ziemer team and team Lenticule Congress, Dr. Rohit, everyone for this opportunity. So as you can see, I've already marked, and all marks are corresponding on the first Purkinje image of the microscope. And now I've switched on the suction. The advantage of this machine is very well here. You can see, the same patient without moving the patient. We can actually finish everything, and this is actually my cataract OT where I'm doing it. And this is the one big advantage. So if you're able to see the screen, you can see the 3 marks are aligned, and there is a auto alignment for cyclotorsion. Star image. So yeah, थोड़ा सा clockwise rotate करें, clockwise थोड़ा सा. Yeah, ज़्यादा वापस. Yeah, ठीक है. Left side left, थोड़ा सा left. बस. Right. Down. Down left. Bring it down. Keep bringing down. और नीचे लो. Blue marks पे लाना है. Blue marks पे. और नीचे लो. Blue marks पे लाओ. Yeah. Yeah. थोड़ा और नीचे.
Dr. Geetansha, this is connected to the Galilei now, or it's going to be connected to the Galilei?
No, sir, this is not connected to Galilei. It is directly being done. So I think it's very well aligned. So centration and cyclotorsion
is it possible? It's possible.
It's already connected.
If somebody has a Galilei, it can be connected.
You can connect it.
So it takes.
So this machine has option of 2 cuts, but now I'm comfortable with single cut. Yeah, go ahead. Yeah, go ahead. Yeah, I'll start. So this is posterior cut, which will start after making a venting in tunnel. So this is the posterior cut, which is convex, and then there will be anterior cut, which is going to be flat. Now this is the anterior cut, which is going on. The side cut is also made. Yeah. So the energy I've kept here is 30 and 32, and I think Dr. Roop was telling about ideal, so this is close to ideal, I would say. Lock करना क्या रखें? Sit पर रहे माइक्रोस्कोप. बेटे सामने देखते रहो लाइट में आप. सामने बेटा हिलना नहीं है. डोंट ब्लिंक. दोनों आँख खोल के रखने बेटा. So these have entered the anterior plane. And now this is the posterior plane. You can see the dissection is quite smooth.
So do you always do this dissection from one end to the other, like from left to right or something like that, or do you dissect the center first?
Yeah, Prakhyath. I think actually anterior I go from one end and then I cross it. And second, I prefer to go, no, not at the center as you can see. I'll be going, leaving some attachment so that there is no free movement of, disc till I, yeah. And on the other side.
Can you focus a bit on the cornea? It's getting slightly defocused.
What was the thickness of
Is
this
it
patient?
focus better now?
Yeah, okay. Sir is asking
Sorry,
what
come
was the
again,
thickness of the pachy?
A packing.
The pachy of the patient.
539. Line.
Excellent, sir. Come out very well.
Thank you, sir. Your words means a lot for anybody, not only me. So these are complete disc which is out now. Initially, I used to put fluid inside the, in the interface, but lately I've realized, these bubbles go away in few hours, and first post-op day, vision and everything is better if we don't insert anything.
What is the size of the suction, Natasha? The the whole thing?
It's 10 mm, sir.
10
But
mm.
the 10
It's
mm
a
is
limbal
the
suction?
applanation. No, it's a limbal suction.
It's a limbal suction, sir. Yes,
Applanation
yes.
is 10 mm, and the suction ring goes up to 12 mm.
So it may not have a huger impact when you have a different white to white diameter.
Yeah, it
So that
won't.
means
Sir.
that's one good thing is that when you have a bigger suction space, your white to white
Yeah.
has a huger impact. So your small eyes, big eyes and all, it fits in pretty easy.
Absolutely.
Exactly. So
And you
drop
don't need to
it, drop
change
it.
the size
Lubricate.
of the suction ring. It's standard for all patients.
So you don't have like size, medium, small
No,
and
you
anything.
don't. It's a standard suction ring for everybody. For
Sorry.
Lubricating.
There are different suction ring
antibiotic.
sizes for clear as well, but the inner diameter, the applanated area, that changes, but the outer diameter where the suction is applied, this is the same for all.
बेटा right हो गया श्रेया, ठीक है?
Excellent. So
Drop. Total.
I would like to ask all three of you, see what is your present energy setting, and all three of you are having the similar one, or I mean this is what I hear from all the users, which is a very important take-home point. The machine which works excellent with certain suction, spot size and energy with Prakyat may not have the same thing with me, whether it's Silk, Smile, Ethos. So you have to, and that's why I like the title of the talk, Find Your Sweet Spot. So anybody who's want to get into Lenticule, find your own sweet spot. It's not difficult. It's just about finding in the first 15 cases, 20 cases. Prakyat probably has done phenomenal work with Ziemer in finding the sweet spot over the last 1 year or more, and Geetansha and Shreyas, I think we all have to give the credit, and Natasha is doing this work. It's important because when they give you a sweet spot, it is a reference. It's not a benchmark that you have to use what Prakyat is using, what Natasha is using. It's a reference. So any technology you use, the take-home point is use that as a reference. Use what Dr. Geetansha is doing, Natasha is doing, or any one of them are doing. But then you follow what is that range in which I am comfortable. So when you do this surgery, many times the second important point is we buy a very costly machine. We know today it's very difficult to do a return on investment. And we have some 10 very important patients lined up for you. It could be your own family member or some VIP. I have this thing which always I keep getting, oh, I operated on this VIP. I said, why? It's a second case. You know, it is, you have to be so careful with it. You have to probably do some amblyopicai or something. And then you find that sweet spot. And when you find that sweet spot, then you can operate on the precedent of your country. But till that time, be very patient, because one thing is, Prakyat's, Natasha's or Gitanshas is perfect silvery, beautiful silvery reflex, which is what you would call the most optimal laser setting of any machines. And then you go and say, I will use the same thing and I will do it. It doesn't work that way. It's not worked with Smile, it not worked with, there was a time I learned, Dr. Sri Ganesh sir used to have the spot, I used to go and say, let me do it, it didn't work. Then I had to find my sweet spot. I had to find my energy with silk. So I think all of us agree here, there is no one spot which is sweet for everybody. It's only the benchmark. Agree?
100%. So, in fact, if I talk about my own journey, I had the longest curve to achieving the sweet spot because all of the other machines were in the range of 35 to 38 percentage. But
That's
my
the reason
machine was very, very low.
Exactly. That is the reason I thanked Shreyas, Gitansha, you, and all these pioneers, and now Natasha is following there, who took a lot of efforts to reach that spot and give people a benchmark. And I thank a lot of people who started with high energies with Zeiss, and today Sri Ganesh sir showed that you can go up to 100 with silk. We used to start at 60. Maipal and me, we used to say we are 60, 65. Now I think tomorrow sir is going to push the limits. So that is where I think we have to thank on this platform all those innovators here who have taken risk to face that patient. It's very easy to say, sir, Natasha said, I did a very low energy, but I had a black spot. We all say, yeah, that's fine. But Natasha has to see that patient for the rest of her life. Prakyat has to see her all his 50 patients for the rest of your life. So for the engineers, for the companies, these are all unsung heroes of refractive surgery, because I know you make great machines, but you are not the one who are facing an angry, choleric patient who is going to come tomorrow and say, I have a poor vision done by you, and that affects your practice. And especially people like Prakyat and Natasha Ved, I think it's not that the institution like academic practice, they are academic people, but there is a lot of thing which is driven by it. So I like people who take that extra leap, and me and Gitansha come from a little bit academic, where the patients look at, they may not just come for me, they come for the thing. But here, when you have that personal one-to-one bond, it's even more difficult. I'm not saying that me and Gitansha will have much easier thing, but we all have to always thank these people who have gone that mile to give people a benchmark. And the companies, whether Schwinn, Silk, Atos, every single company has to be ever grateful to these surgeons who said, I will do it and I'll take a chance. And a big round of applause for all of them, including myself. Yes, Natasha.
I just, because we are thanking the innovators, I would like to congratulate Ziemer on this, because if you see the refractive error that was corrected, it was not 5, it was not 5.25, it was minus 5.05. So they have built a beautiful nomogram based on the eccentricity of the cornea, and you don't have to put your signs, just put the number in an Excel sheet, it will give you an adjustment and a target. So our numbers, the refractive error that we correct are not like lenses, it comes in steps of 0.25.
So it's an inbuilt nomogram.
It's a beautiful
Excellent.
nomogram.
Maybe if as an input from Ziemer as a company, and I think I can also speak for the other companies. I think we are very grateful for this.
Every
work.
company
as
should
you
be.
said, that is, and I think we should be humble, and we really value this feedback also, because we continuously try to for new users to improve the starting point, and that where you can. If a new laser is installed, what are good settings we learn from all of you, and try to incorporate as much of this feedback as possible. Yeah, thank you.
Yes, thank you. Just two comments maybe. So the first one, I think I fully support the comment just made on the innovators for sure. I mean, I think that's great. And what we are working on, and I assume all companies are working on is to objectivize the start or the installation, objectivize the initial setting and make that as objective as possible, and take means, and that's what I meant also by innovation on service or application, have external means so that you don't have to do your first 10 patients with kind of an uncertainty of potentially having good or not so good cuts. That's one aspect. The other aspect I think which I find quite interesting, and even though Ziemer takes another perspective on the dose topics and so forth, but I think if we look across all companies, I would say whether we call that dose or whether we call it energy per surface or whatever concept we admit, but I do think we see across all companies that by lowering the energy per surface, and some of us are approaching that by lowering the spot energy, some of us are approaching that by keeping the spot energy at the surface level, and as we do, increasing spot and track distance, and we have seen Zeiss also going towards the spot and track distance approach. So I think we all have similar approaches, but we have seen that across presentations, when we go down with energy per surface, we get better results in the patient. And I think that, for me, is quite an insightful element across all platforms.
Thank you for echoing the same sentiments. We have one word from the innovator of innovators himself.
I'd just like to sort of clarify, there is always a confusion between the clinical use of physical terms and the physicist's use of physical terms. And what we're really talking about is fluence, and that is energy per unit time per unit volume. And that's the crucial element here. So please stop using this word dose. It doesn't mean too much. The second thing I want to say is, great, all the companies are doing a fantastic job pushing their understanding and algorithms as far as they can. 2 decimal places, I think, is a little bit too far. And the problem is that the cells just haven't read any of the optic textbooks. So the cells don't understand the perfection that we are trying to achieve. So just be careful. Always remember, we're dealing with a biological entity, and the wound healing processes, unfortunately, may surprise you. It may be a good surprise. It may be a bad surprise. And you're absolutely right, Rohit. The person that takes the blame is the guy that presses the button in the operating theatre, which is why I tell all the patients, your surgeon will have gloves and a mask, so you can't recognize him and he won't leave fingerprints.